Hey. I've been getting requests on how to do more advanced techniques on scar tissue massage, especially ones that, you're 7 weeks or 10 weeks or 3 months out. That's a completely different style of scar tissue massage. And so right now, what I'm doing is very gentle, and you're past that point. And so I'm going to go ahead and do some scar tissue massage on a scar that I've already worked on, and it's completely soft and not attached to any flesh underneath. So obviously take into consideration where you're at. You want to make sure that you're at a point where this is okay with the scar. So I would say at least 7 weeks out, doing this much. But you have to gauge. You have to gauge how much is too much. If you're in a lot of pain, don't be doing some of this. If it's a little tender, that's one thing. If it's a good pain, like, oh, that it feels like it's stretching, that's fine. But if it's like, ow, don't do it. Really listen to your body here. It's really vital to be listening to your body at this point in time and know what's best for it. So this is my scar. I've had this for years. It's on my leg, and it's gonna be a little hard to like show you everything because it's on the side of my body. But so you can tell like it's not attached to anything, because otherwise it'd be pocketing. So I'll give you an example. So here's my knee scar, right? So if you're seeing like, see how it buckles right there, that pocket? See how it does that? That means it's attached there. Same here, there's an attachment there. This isn't moving either. Here, there's none of it. It's not attached to anything. So that's key thing, that's where we want to get. Okay, so things that you can do, first of all, you definitely want to warm up the area. So warming it up is going to be going around it, just like in my first video. You definitely want to warm up the area. You can do lymphatic massage, and because you want to make sure that's flat enough where the fluid can kind of go back through it. You can kind of massage around it. And with a scar that's like 7, 8, 9 weeks old, you can massage on it. Now, I'm not putting a lot of pressure on here, but even with my scar on my knee, I'm actually doing a very gentle version of this. But with something that's 7, 8, 10, 3 months, or 7 weeks to 3 months or whatever, you can kind of get in there. Now, if this is attached, it's going to be painful. Notice what I'm doing. I'm not just doing this. I'm pulling, and then I'm massaging. Depending if you have any pain, you might want to go more gentle. Or you can go more firm. You can do that a few times, getting it really warmed up. And I think it's really good to do big circles if it's not in pain, because the bigger circles you do, the more it's going to actually pull on the tissues around. And then you kind of just gently do a pull like this and just see how it feels. And once you feel comfortable, you can pull farther. Now, you might feel the tissue attached to the skin or the muscle below pulling. You want to pull to the point where it feels good and doesn't feel bad. You might feel it ripping a little bit. That's okay. You might feel like a little sting, like a little needle, kind of like, or thread, like, and letting go. And you do it on the other side, and you're just slowly pulling. I can do a lot more on this because this scar is years old.
It's also good, you know, once you've warmed it up, to pull on one side of the scar, because if anything's attached, especially a lot of times they'll attach at the end, this will actually cause a pull. I do that on my scar here, and there's a pull, and I can feel it starting to slowly rip, which is great. And then you pull on the other end. I'm going a little faster than I normally would, just because I want to get a lot in here, and I don't want you having like a 30-minute video on this. So take your time with all of this. Go slow. You know, 1 or 2 fingers, again, rotating over. Taking 2 fingers and going from, now so this scar actually goes all the way from here, like it goes halfway around my leg, it's insane. But I'm going to just show you the parts that are seen. Now this is a medium kind of depth. If your scar is comfortable with it, you can go deeper. Really watch like what works for your scar and your body. Right now this doesn't hurt at all because nothing's attached. And what's great is it gets the circulation going and stuff like this. What you want to do is you want to get to the point, and you can practice this at 7 weeks. You can just kind of even just do this maybe at 7 weeks. But with this scar, what's great is I can roll the whole entire thing. There's no attachment. It's like boom, I can roll the whole entire thing. And that, when you get to that point, you know that your scar is really healthy. So you want to massage on both sides, medium to deep, because this is going to help it release the tissue. And I'm going in there pretty deep. I'm not bruising myself. You don't want to bruise yourself. Like, no massage do you need to go that deep. I know a lot of people who do deep tissue massage, and they just go way too deep, way too fast, and people get hurt or their muscles go into shock. It's like that. I used to do deep tissue massages all the time, and I would take 5 hours to relax their body. And so, you know, it takes time for the body to let go. So you can sometimes just pull this way a little bit. Now, this is not for the first month or 6 weeks. This is like 7-10 weeks. You want to, and this is a gentle, you don't want to pull it open. You're just gently pulling. Just gently pulling. So, but you want to get in there. You want to be able to roll it. You want to be able to massage it deeper. You want to be doing cross things like this. Or I also will go at an angle and pull, because a lot of times it might not pull this way that you can feel the tissue, but maybe this way, or this way, or this way, or this way. And still do the lymphatic massage that I was showing you. But those are a few techniques that you can be doing that will loosen it up. And I know I'm forgetting one right now, but that's a good start for you. So gentle, listen to your body, don't hurt yourself, don't go too deep. When in doubt, go very slow and very light, and work your way into medium and work your way into deeper. So good luck. Ciao.